Good evening, ladies and gentlemen, and welcome to Wednesday Night in America here on the NDB Media Network. My name is Rogelio Noriega, and I have a special tonight. It's been updated, and I need to share this information with you. I am an ambassador for Los Angeles County related to COVID 19, or a COVID 19 ambassador. That is the title. I'll show you my certificate near the end. What it means is I volunteered. There was a need to do this, and I chose to do it. And I'm doing it this evening because I want to, and I feel that I need to, because I hear so many things which are just flat out wrong, for lack of a better word, ignorant. And I hope to be able to assist you in understanding just a little bit more of what's going on right now. But we're going to get to it right now. And as I mentioned, it is Wednesday Night in America. And let's see what we're going to do. Let me see. There I am. I'll throw myself down there at the bottom. So we're going to get to it. Of course, tonight, facts, not fiction, no conspiracies, only science. And we are reporting from the same source. We're not using anything else. We are using CDC figures, California Public Health for LA County, and maybe another one, but we'll have to get to that in a moment. But we are only using reputable sources. We are not YouTube scholars. We do not go by rumor and innuendo. We are sharing facts. So I'm going to go ahead and continue. Ignorance, as you know, is darkness. It's loneliness. It's dangerous. It's reckless. And it leads to long-term damage. Hopefully I will be able to enlighten you a bit, and we're going to go and go down that course together. We are, as I mentioned, talking about the Omicron variant. The World Health Organization, otherwise known by the acronym of WHO, classified Omicron as the variant is known as B11529. It is a SARS-CoV-2 variant. It was named Omicron on Friday, February 26, 2021. And if you bear with me, I will have a timeline later in the program. It was first detected in South Africa on November 9th, 2021. At the time, 7 countries, including South Africa and the Netherlands, had it. As of November 30th, yesterday, the first reported case was in Canada. As of today, so there may be a little bit of an update later that I have to clarify, but as of December 1st, 2021, the first case was reported in California, in the Bay Area, if I'm not mistaken. Why is it different? We know that a variant is a mutation. And the thing about this one is it's very unusual, the constellation of mutations. And we'll get to the explanation in a moment. Early analysis shows there are 50 changes and deletions, more than 30 of which are in the spike gene. The mutation profile is clearly very different from other circulating variants of concern and variants of interest. It does not appear to be derived from the Delta variant or other variants of concern as of right now. Some of the mutations to the spike gene could affect the structure enough to increase ineffectivity, evade immunity, and impact response to monoclonal antibodies. Early signs from diagnostic laboratories indicate that Omicron spreads rapidly and is now the dominant strain in South Africa and is likely to be present in most provinces in South Africa. At this point in time, it appears that current antigen and PCR tests do in fact detect the variant. As of now, 16 countries have already identified Omicron cases. South Africa, China, Belgium, the Netherlands, Botswana, Germany, Italy, Czechia, Israel, United Kingdom, Australia, Canada, Portugal, Ireland, Spain, and Sweden. And as of today, December 1st, it would be 17 countries. The United States is now included as well. This was prepared yesterday. No cases have currently been reported in the U.S. Strike that. As of today, yes, December 1st. Or LA County, but that is still as of correct. Nothing in Los Angeles County right now. But as Dr. Fauci said this weekend, it is safe to say that it is likely already in the country. It was prophetic. You knew that already. LA County, which is my home county, is already taking action by providing residents and partners with updated information about Omicron and appropriate safety measures. LA County healthcare providers will receive an advisory from the Department of Public Health detailing information on assessing risk and directions for submitting samples for sequencing. Residents can also go to our website for daily updates on Omicron. I apologize that I do not have the link here, but the link is ph.lacounty.gov or publichealth.lacounty.gov. The Department of Public Health is working with all school districts to reinforce the importance of existing school-based public health requirements and routine testing programs. Department of Public Health has teams realigning plans for protecting those who are most vulnerable, including those living and working at skilled nursing facilities, jails, and shelters. DPH is working with the state to provide information and offer a rapid testing option for international travelers at LAX, including those traveling from South Africa, Botswana, Zimbabwe, Namibia, Lesotho, Eswatini, Mozambique, and Malawi, including messaging to international travelers arriving from those 8 countries to ensure they are in compliance with the additional quarantine and testing requirements. The steps to reduce your risk. Get vaccinated and get a booster. The vaccines are effective against the Delta variant and very effective against the earlier strains of the virus, which gives us hope that the same vaccines will also provide some protection against Omicron. Residents aged 5 and up can walk into any public health vaccination site or make an appointment. For more information, ph.lacounty.gov, publichealth.lacounty.gov. Continue adhering to the masking requirements and always wear a mask when indoors or at large outdoor mega events. Testing is essential as it is an important tool in quickly detecting and reducing spread. Any resident who is sick, was exposed to COVID-19, or traveled internationally over the holidays is encouraged to get tested. Anyone who does test positive must stay at home for at least 10 days since your symptoms first started. You do not have a fever for at least 24 hours and your symptoms improve. Quarantine if you are a close contact to a confirmed case. California Department of Public Health issued a fact sheet on the Omicron variant, and that's what we're going to go over in the next few slides. What do we know about the Omicron variant? We are still learning about the new variant, including how it spreads and infects individuals, as well as how it responds to vaccines. Here is what we know. New variants will continue to evolve as long as there are large proportions of unvaccinated people. This new variant has many mutations in important areas of the virus that impact infectiousness and the ability of the immune system to protect from infection. Some of the mutations are concerning to scientists because they are very different from other variants previously detected, and some are similar. We do not know at this time if this new variant causes more severe COVID-19 illness than other variants or how it might impact response to treatment. Continuing the fact sheet from the California Department of Public Health. What is California doing in response to the new Omicron variant? CDPH is taking the following steps to protect Californians against COVID-19 and the Omicron variant. Monitoring for the presence of the variant in California through the California SARS-CoV-2 Whole Genome Sequencing Initiative, known as COVIDNet. This is a public-private partnership that provides California with genomic sequencing to help understand and control the spread of COVID-19. COVIDNet gives us the ability to detect variants early. CDPH is partnering with the Federal Centers for Disease Control and Prevention, CDC, to gather information and expertise to help the public, local public health departments, and healthcare providers. CDPH is preparing to increase COVID-19 testing at airports across California for U.S. citizens and legal residents returning from South Africa, Botswana, Zimbabwe, Namibia, Lesotho, Eswatini, Mozambique, and Malawi. focusing on COVID-19 vaccination and booster efforts to ensure that all Californians have access to safe, effective, and free vaccines that can prevent serious illness and death from COVID-19. It is not too late for anyone eligible to get vaccinated or boosted to protect themselves and others against COVID-19. I do want to we do have people watching us now, and I thank Tony for the like already. Folks, if you are watching, let me know who you are and where you hail from. But I'm going to be getting to this right now, and I thank you for spending time with me this evening. Additional resources. What can Californians do to protect themselves from COVID-19 and the Omicron variant? There are 4 specific actions that can be taken by all Californians today to help slow the spread of COVID-19, including the Omicron variant. As I mentioned previously, get vaccinated, wear masks, get tested, stay at home if you feel sick. What is a variant of concern? I mentioned those earlier. Concern of interest. The World Health Organization determines which variants are of concern based on having one or more of the following changes that could impact global public health. Increase in transmissibility or detrimental change in COVID-19 epidemiology, or increase in virulence or change in clinical disease presentation, or decrease in effectiveness of public health and social measures or available diagnostics, vaccines, or therapeutics. For more information, tracking SARS-CoV-2 variants at who.int. Can COVID-19 tests detect the Omicron variant? As I mentioned earlier, yes. Current understanding is that available PCR and antigen tests should detect this variant. The U.S. Food and Drug Administration, FDA, is currently confirming this information. This is as of November 30th. Today's video is December 1st. What should someone who is returning from a country of concern do? The CDC recommends that travelers from Southern Africa, Botswana, Zimbabwe, Namibia, Lesotho, Eswatini, Mozambique, and Malawi to test within 3 to 5 days after arrival, quarantine for 7 days, and isolate and test if COVID-19 symptoms develop. Here is the timeline that we know of the Omicron variant. On November 9th, the first known confirmed infection from a specimen was collected in South Africa. On November 24th, South Africa announced the detection of a new variant following genomic sequencing. That was fast. On November 26th, mentioned previously, the World Health Organization designated B11529 a variant of concern and named it Omicron. The U.S. government placed a travel ban for non-U.S. citizen travelers from South Africa, Botswana, Zimbabwe, Namibia, Lesotho, Eswatini, Mozambique, and Malawi. On November 27th, at least 115 recorded cases have been identified, with most from Botswana and South Africa, and others from Hong Kong, Belgium, Israel, Germany, Netherlands, and the United Kingdom. And as I mentioned, as of today, December 1st, the first case was detected in California. For those of you joining me now, thank you. It was detected in the Bay Area. I do not recall if it was San Francisco or San Jose. The White House statement on Omicron COVID-19 variant. These are the words of the president. This morning I was briefed by my chief medical advisor, Dr. Tony Fauci, and the members of our COVID response team about the Omicron variant, which is spreading through Southern Africa. As a precautionary measure until we have more information, I am ordering additional air travel restrictions from South Africa and 7 other countries. These new restrictions will take effect on November 29th, 2 days ago. As we move forward, we will continue to be guided by what science and my medical team advises. For now, I have 2 important messages for the American people and 1 for the world community. First, for those Americans who are fully vaccinated against severe COVID illness, fortunately for the vast majority of adults, the best way to strengthen your protection is to get a booster shot as soon as you are eligible. Boosters are approved for all adults over 18, 6 months past their vaccination, and are available at 80,000 locations coast to coast. They are safe, free, and convenient. Get your booster shot now so you can have this additional protection during the holiday season. Second, for those not yet fully vaccinated, get vaccinated today. This includes both children and adults. America is leading the way in vaccinating children ages 5 to 11 and has been vaccinating teens for many months now. but we need more Americans in all age groups to get this life-saving protection. If you have not gotten vaccinated or have not taken your children to get vaccinated, now is the time. And finally, for the world community, says the president, the news about this new variant should make clearer than ever why this pandemic will not end until we have global vaccinations. The United States has already donated more vaccines to other countries than any other country combined. It is time for other countries to match America's speed and generosity. In addition, I call on the nations gathering next week for the World Trade Organization ministerial meeting to meet the U.S. challenge to waive intellectual property protections for COVID vaccines so these vaccines can be manufactured globally. I endorse this position in April. This news today reiterates the importance of moving on this quickly. This is now the CDC statement on the Omicron variant. As you notice, media statement for immediate release on November 26, 2021. Contact Media Relations at 404-639-3286. Once again, that's 404-639-3286. And when you call them, you can let them know that NDB Media did a follow-up on their media statement. On November 26, 2021, the World Health Organization, WHO, classified a new variant, B11529, as a variant of concern and has named it Omicron. No cases of this variant have been identified in the U.S. to date, November 26th, 5 days ago. So the CDC is grateful to the South African government and its scientists who have openly communicated with the global scientific community and continue to share information about this variant with the U.S. Department of Health and Human Services and CDC. We are working with other U.S. and global public health and industry partners to learn more about this variant as we continue to monitor its path. CDC is continually monitoring variants, and the U.S. variant surveillance system has reliably detected new variants in this country. We expect Omicron to be identified quickly if it emerges in the U.S. This is as of November 26th. As of today, December 1st, it has been identified in the Bay Area in California. It's almost home. We know what it takes to prevent the spread of COVID-19. CDC recommends people follow prevention strategies such as wearing a mask in public, in indoor settings in areas of substantial or high community transmission, washing your hands frequently, and physically distancing from others. There's no one here. CDC also recommends that everyone 5 years and older protect themselves from COVID-19 by getting fully vaccinated. CDC encourages a COVID-19 vaccine booster for those who are eligible. Travelers to the U.S. should continue to follow CDC recommendations for traveling. CDC will provide updates as more information becomes available. That is the media statement, and these are additional resources, www.cdc.gov. For the president's statement, www.whitehouse.gov. State of California, as I mentioned, California Department of Public Health, it is www.cdph.ca.gov. And in my home county, Los Angeles County, www.publichealth.lacounty.gov or ph.lacounty.gov. I am a COVID-19 ambassador. This program was presented to me, and they were asking for volunteers to simply share information. That's what I'm doing tonight. Folks, I won't get into any emotional stuff other than what I'm famous for, but I have felt the loss close. Family, coworkers, extended family members, people in my universe. I have felt it, and it troubles me that this is going on. And I don't want to be responsible for sharing anything that is incorrect. So when this program was available, I did sign up. I did go through the training, and this is as of July 1st. I still did more studying and preparation, and I still did not do my first video until today. That's how serious I take it. And I'm trying to share information with you. They are Los Angeles County volunteers, not only employees, but people at large. We are in association with the Los Angeles County Board of Supervisors, Los Angeles County Department of Public Health, California Department of Public Health, and Centers for Disease Control. That's my certificate of completion. That's me. I am a COVID-19 community ambassador. I am proud of that insofar as that not that I have a certificate, well, wow, but that I completed the training. I understand the information I'm sharing, and I hope that I am making it easy for everyone to understand as well. I don't know how often I'm going to be preparing these programs, but I decided to do this one today, right now, only because it's now out in California. It's the first one in the United States, if I'm not mistaken, but don't quote me on that one. But we do have a confirmed case in California in the Bay Area. Had to pause. Sorry about that. And that pretty much is it, folks. That is my last slide. I want to thank everyone that joined us. And I am going to be updating information. I am provided a ton of information. And at times it is overwhelming. And I'm trying to make it as easy as possible to understand. And it's, look, I was in the health field for some years. But no. I worked at a hospital, worked at a clinic. I've worked at many different places. I do not pretend to be a medical expert. I am nothing when it comes to medical. But I do read a great deal, and I do ask questions. We should all ask questions. We need to. It's our lives. And folks, you know me. The reason why I'm doing this is because I see the need and I want to help. It's in my nature. So I want to thank everyone for joining me, and I want to thank you, Tony. I appreciate that, Tony. Thank you. As I mentioned, I don't know how often I'm going to do these, but I'm starting to get repetitious now. But I do want to tell you that I will be doing a few of these in the future. We'll see if I get slapped. It will be reviewed by public health, and I go to the resources, folks. Go to them. If you have questions, ask me, and I'll do my best to get an answer. But I'm not a doctor. I'm nowhere near that. But I'm trying to share facts. Folks, the numbers are 5 million people have died worldwide. And in the United States, I believe it's over 800,000. I know I can rattle off, and I didn't mean to say rattle off, but I know of 11 people that were close to me. In their memory, I do this. So I thank you for your time, and I thank you for your understanding. And if you want to join us shortly, we will be on within a little more than 30 minutes. We're going to be doing another program tonight, the return of the professionals on Sports Talk with the Guys. We will be on within the next 37 minutes. But for now, thank you. Thank you, Tony, for your commentary. Anyone else, please share. If you don't believe me, share your opinion. But share why. But beyond that, facts, not fiction. That's what we're trying to do here. So for now, folks, thank you. Thank you for your time. We'll see you guys on the other side. Peace. We can get through this.